Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet. I am Bob, and exactly one half of the Bob and Brad team. And my guest today is Dr. Joseph Allen, an optometrist from Minnesota, by the way. And he has a great YouTube channel called Dr. iHealth. We'll talk about that. We'll talk about his background, but he's got a lot of great advice for you. If you have one or two eyes, I would check it out. Thanks for watching. Welcome to the program, Dr. Allen.
Hello, and thank you so much. I appreciate it.
Well, I'm going to go to the first question. It's going to be a selfish question because I have eye floaters in one eye. I got them probably about 3 years ago, and I looked it up and it made it sound like it was really a problem. So I've kind of adapted to it, but how do you get rid of eye floaters?
So that's a really common question. As you know, first off is understanding, like you did, you researched and figuring out, hey, what are these things? What am I experiencing? I think a big thing is just understanding floaters are a normal occurrence. A lot of people, if you're not sure if you've experienced them, especially on like if it's a blue sky day, if you look outside, you look kind of side to side.
That's exactly it.
You see those little floating spots. They look like gnats almost. You maybe think that there's bugs flying around you.
Yeah.
Those little spots are really shadows of light that are being cast onto the retina inside the eye by clumps of collagen and protein fibers trapped within the gel on the inside of the eye. And so those little floaters, you know, when you're young, a lot of children and young adults don't really have them, but as you get older, they are more common to be found, especially over the age of 50. And the older you get, the more common, more likely you are to have them.
There we go. Makes sense.
So thankfully, they are not typically a medical emergency unless somebody has all of a sudden hundreds of them. You know, one day it goes from nothing to all of a sudden you're seeing many of them. It looks like a snow globe, maybe. Or if they're associated with flashes of light or any loss of vision.
Gotcha.
If somebody has that, then they, of course, want to contact an eye care professional right away just to be seen so that the doctor can inspect the back of the eye. As these floaters, this gel inside of the eye changes, the interface, the connection of the gel to the retina can separate, kind of like you're peeling Velcro. That's how I like to describe it. But unfortunately, when that gel separates, it can tug on the retina and sometimes cause a hole or a tear in the retina. Which then allows fluid to seep behind the retina and cause a retinal detachment, which, if not caught early, can lead to vision loss and blindness for some people. So again, if somebody's listening to this and they just recently saw that, like a sudden change, then definitely contact your local eye care provider. Otherwise, to get rid of floaters, because a lot of people come in, they're like, I'm maybe like you have, you're like, I'm seeing these spots. They're kind of driving me crazy a little bit, right?
I've adapted. I mean, they don't bother me.
Most people are like you. Well, they learn to adapt, and they usually get better when you first notice them. They usually improve over the first 6 months. People either adapt to it, they get used to it, or they maybe drift out of view a little bit, and you don't notice them as much. For the people who are really bothered by them, like you have trouble functioning, driving, being able to see, you know, enough in order to live your daily life, then there are some surgical operations to remove them. The oldest one is called a vitrectomy, and that's where a surgeon will surgically remove the gel from inside the eye and replace it with an alternative fluid. That does remove all of the floaters. Most surgeons, though, don't like to do that procedure. It comes with some risks, namely, if you still are phakic, meaning you have the natural crystalline lens you were born with, you are going to rapidly develop a cataract afterward.
Oh, wow.
So there is some connection between the gel inside the eye providing a lot of nutritional content to the crystalline lens inside the eye. So once you do start to develop floaters in this gel separation, you rapidly begin to develop a cataract. And so just the surgical procedure causes a lot of inflammation, which also speeds up cataract development. And most surgeons don't like to do that procedure because there is always about a 2% risk of having like either an infection or some sort of retinal tear or detachment just due to the procedure.
Sure.
And nothing's worse to an eye surgeon than for someone to come in with relatively 20/20 vision, but symptomatic for floaters. They do that procedure, and oh no, now they caused a retinal detachment, and now they have permanent vision loss. That doesn't look good for liability.
Yeah, even 2% is high.
Yeah, it's higher than zero. A lot higher than
right.
zero. And then the other procedure, which is a little bit newer, is using a laser called a YAG laser to do what's called laser vitreolysis, which I have videos on this, but they use the laser to zap the large floaters in the view of your vision.
Gotcha.
They don't 100% get rid of all the floaters, but they do disperse them. They make them much smaller, less noticeable. And that's currently the two, at least most commonly used procedures to help people with their floaters.
So Dr. Allen, I only have it in one eye. Is that common?
It's usually asymmetric. So it's starting usually in one eye and then the other eye may follow.
Sure.
And I haven't done an examination on your eyes, but I imagine your eye doctor has probably seen at least the beginning or some development of the floaters developing in the other eye that you're not really experiencing it in. So
something else to look forward to as I get older.
You can learn. I try to make friends with them, right? Some people I know, they name them because they see them all the time.
Oh, there is. Okay.